that's made a recommendation that we do go ahead and expand Medicaid coverage for people up to 138% of the federal poverty level. There's that nasty term again. Again, that's about $15,800 for a single individual. What I always tell people about Medicaid, people always assume that if you're poor, you get Medicaid. Well, not really. You have to be poor in something else. So for instance, I give myself as an example. I'm 58. If tomorrow I had no income and no assets, would I be eligible for Medicaid? And the answer is no, because I'm not disabled, I'm not 65, and I don't have, I have children, but they're not dependents of mine anymore. So I wouldn't be eligible. What this would do is make people like that eligible, who have no income and no assets, but also don't have a disability. And actually, there are people up to the $15,800 who are actually working who would be eligible, who literally just, at that income, can't afford health insurance. So that's the purpose of it. We don't know yet whether it's going to happen. We know we're going to have a special legislative session next month. There'll be a decision made, and the potential is that it'll be up and running for January 1st or sometime soon thereafter. We don't know. So if you're in that situation, or you know somebody who is, I think what we have to say is kind of stay tuned. And particularly, go to a place like a Service Link, and I've got some brochures in the back for them. Call them up and ask them and find out what's happened. And just find out, has it been expanded, or will it be, and if so, when? So that's kind of what I think would be the way I would approach it. Do you want to do these, or we do a couple more?
Well, I'll start anyway.
Yeah, go ahead.
I mean, people with health insurance, as you can imagine, we are talking about the Affordable Care Act, and the reality is that the vast majority of people in the United States do have some kind of insurance, either through Medicaid that Doug was talking about, Medicare, which is an entirely different program, through the Veterans Administration benefits if a person is a veteran, through other kinds of employer-related health care insurances. So a lot of people are covered already. And so what we're looking at tonight is, for those people, primarily are categories of either they're not insured at all, or their coverage is very weak, and they need more coverage for their particular health. And other groups that fall into, and I guess it escaped me. I thought there was one more.
Oh, I'm sorry. I'm getting ahead of myself here.
There's, I believe, one more, but in any case, the point is that many people are covered by a variety of health insurances already. In terms of what the law provides, it really provides a number of ends discriminatory insurance practices. Insurance plans can drop coverage if you get sick, and you may know that, or have experienced that situation yourself. The insurance companies in the past have been able to limit their plans if you get sick. Insurance plans have to justify increases to premiums. They can't go above 10% without a justification. No one can be denied coverage for a pre-existing condition. That begins in 2014. So if you've got asthma, if you've got diabetes, if you've got high blood pressure, any of those pre-existing conditions, you no longer have to worry about being covered by health insurance. You can get health insurance. And it eliminates lifetime limits on coverage. So if you have some serious illness, and just when you need health insurance perhaps the most, this now will allow for that to happen. Eliminates annual limits. So you can't be denied health care because you've exhausted, we'll say, a cap of $10,000 during the course of 1 year. So these are some of the discriminatory insurance practices that the law ends prior to the implementation of the Affordable Care Act. This is a great benefit for young adults. Children can stay on their family policy until age 26, even if they get married, even if they no longer live with you, even if they are no longer in school. And many parents, young adults especially, who couldn't find jobs after college, for example, are now able to benefit from this insurance. One of the nice things about this law for all policyholders, including Medicare policyholders, it allows for preventive services at no cost. So mammograms, immunizations, screening for cancer or diabetes, and other preventive types of procedures and tests can be provided at no cost. The donut hole. You may have heard about this if you are a Medicare recipient or you know family members that are Medicare recipients and are taking prescription medications and paying for those prescription medications. There's a point where you reach a upper limit and you cannot get partial reimbursement for your prescriptions. And that's the so-called donut hole right here. And what the law has done is it made it possible to begin to fill that hole. By that I mean that once you reach the highest limit, now under the new law, 52.5% discount will be given for brand name prescription medications and 21% discount for generic medications. So the donut hole gets a little bit smaller, and by 2020 it will be eliminated entirely. So for those Medicare recipients, they will no longer have a donut hole. In terms of shared responsibility, otherwise known as, I guess, some of the taxes or penalties that you'll have to pay if you're not enrolled or otherwise accounted for in terms of your health insurance. Let me go through that. You need to enroll in minimum essential coverage, and that's what we're talking about. And perhaps a Brown's plan would be considered the minimum essential coverage. Or make a shared responsibility payment when filing a federal tax return. And I believe that's where we get into the penalty phase. Or qualify for an exemption. And there are different conditions that people can meet for exemptions, which I won't go into this evening. In 2014, the shared responsibility, if you choose not to have coverage, if you make that conscious decision, you have to pay a penalty, whichever is greater. The minimum fee of $95 for an adult for the year, or half that, $47.50 for a child, or a total of $285 for a family. And that's in the first year. In a subsequent year, it actually goes up higher, so the penalty or the fee that you would have to pay would be higher. And it's the penalty or the income, your income for that year, whatever is higher. So the incentive is to get some level of acceptable insurance. That's what they're trying to do here. They're not trying to penalize people, but they're trying to encourage people to get insurance either individually or with their families. Small business owner. There's a tax incentive for small business owners to sign up themselves and up to, I guess, 25 people of their business, 25 employees in their business, I should say. And to be eligible for the tax credit, you can go online to what's called SHOP, or Small Business Health Options Program, a new and streamlined way for small employers to offer health insurance to their employees. And again, this is where you can compare plans and select plans that would be affordable to you and the employees that work for you. SHOP is now available. I've seen it online. And businesses can enroll directly through SHOP, or they can call this 800 number. And there's a calculator that's available for tax credits for small businesses. So if you are in that position and you run a small business and you'd like to get more information about it, you can go online and get that information and actually calculate what the cost might be for you and for your employees. Well, we've covered a lot of material this evening, and this kind of summarizes what we're talking about, increased consumer protections. And by that, we were talking about where the insurance company can't deny you coverage because you have a pre-existing condition, or, for example, your healthcare costs go beyond a certain limit that a current insurance plan doesn't allow you to do so. It improves the Medicare covered benefits for prevention, for example, and it closes that donut hole that we were talking about earlier. It continues employer-based coverage. So if you're an employer and you continue to want to stay with your insurance plan as is, there's no problem with that. It eases the process to shop and compare options. You can compare apples to apples so that you can see in one place what the various plans look like, what the various levels of insurance might be under those plans, so you can, pick and choose what fits you as an individual or you as a family to best accommodate your health care needs. It's easier to process, to shop and compare. I just want to say the easier part. It may not be easier at this minute, but eventually we'll get there. But it is already easier in terms of looking at the charts and being able to compare. Marketplace is the only place to obtain new tax credits and cost sharing. So just keep that in mind. If you're talking to other people or insurance agents, for example, or to others, you need to go to the marketplace for these benefits and so on. Although there are some benefits that extend to all plans. Yes?
What about AARP with their benefits? Where are they with this marketplace?
We're not in the marketplace.
Well, you're not,
No,
okay.
and we don't really offer, the insurance plans that we offer are not traditional health insurance. It's more related to Medicare supplements and things
Right.
like that.
Well, that's what I'm looking too, for Jim.
But that doesn't help you in New Hampshire either, because Anthem is it.
I know.
For-
When you
well,
call
yeah.
AARP, they
No,
go.
it's
Yeah,
supplemental.
well, yeah,
Supplemental.
Anthem's the only plan right now, though they're the only carrier, though there are 11 plans, so there are, even with them, there's some, and you're right that this year there isn't as much, but we've been told pretty much that Harvard Pilgrim has indicated they'll probably get in next year, and we think some other carrier as well. So, for this year, at least you have an option on the exchange. You can get, or a marketplace where you can get something, and we're starting. This is the beginning.
In terms of what you can do to get ready for the health insurance marketplace, certainly you can go to the email website above there, www.healthcare.gov. That's the primary place, I would say, where you can get a heck of a lot of information and begin to establish the process of enrolling into the health insurance plan that you select. You can gather basic information about your household income, because income is going to be a significant factor in what you can qualify for, both in terms of the tax credits as well as the cost sharing. You can make sure you understand how coverage works, and I would emphasize this is complicated. There's no two ways about it. So ask many questions. Ask whoever you work with, whether it's a navigator or some other kind of individual that you're working with to enroll. Get the information that you need. Try to think of as many questions as you can. So make sure you understand things such as premiums, deductibles, out-of-pocket maximums, co-payments, co-insurance. So there aren't too many surprises later on in the year. And keep in mind you can change too in subsequent years. Learn about different types of health coverage, because we talked about catastrophic types of health insurance coverage, but there are many other kinds within the plans. Make a list of questions you have before it's time to choose your health plan. Find local help. Doug mentioned localhelp.healthcare.gov to find help in your area. Get help with a marketplace question. Yep.
And just remember, it's free.
Yes.
So there's really no reason not to get help, and people can walk you through this. So no one should feel intimidated, feel like, oh my God, I don't know if I can do this.
Right.
Some people may be perfectly comfortable going on healthcare.gov when it's working. You can
Yes.
walk through screen by screen. It's kind of like if you've ever done TurboTax or something like that. It asks you questions, you answer, and you go page by page. So that may work, but if you're not comfortable, there's free help.
And certainly be skeptical, be aware that there are people who want to charge fees, who are fraudulent in what they're trying to do and everything. So make sure you're comfortable that the person is honest and that they're giving you the correct information. So this is not kind of a one-time thing, I'll just sign up in 2 minutes and leave it and forget it. You do need to work a little bit at it and try to get the help that you need in order to get the best plan for yourself.
Excuse me, but
Yes.
how do you all figure you can get everyone to do this?
Well,
You don't know how.
yes.
I don't know how. They
Sure.
don't have that thing that everyone else has,
Mhm.
machines and stuff like that.
Sure. I mean, that's
And
perfectly
I could
understandable.
care less. If someone's gonna come to my door in the middle of the night and say, you don't have insurance and you have to have it,
Right.
no. And those people are gonna know better than to say that.
Sure, no question about it. But there's help from a lot of different places. I went online today, for example, and I saw a number of hospitals that are providing individuals who will give information out to people that are going to the hospitals. There was a couple of people that let's see, were at doctor's offices that were designated as navigators. Some of the pharmacies are getting into providing help directly, and they're beginning to advertise. I don't know if you've seen some of those advertisements. Any of the legitimate places that you would normally go to for your health care, you're likely to find someone who can help you. If not now, then certainly eventually.
Sure, if you know enough to do all that.
I appreciate that. It's not everybody who can or will know enough.
Few people that are here tonight. It
Yes.
should be packed.
Well, this is,
They have the things to do and stuff.
absolutely. This is the beginning of information sharing that's going on in New Hampshire. There's a whole agency who will be putting ads in the newspapers, television, radio over the next month or two. And New Hampshire's signing out a little bit later than maybe some of the other states in sharing the information that needs to go out, but you raise a very legitimate point.
But even if they do know and they don't do it, are you going to go after those people with
No,
handcuffs and put them in jail?
absolutely not.
They
No.
know that too.
Yeah.
But you're just going to let people get by with it and the rest of us have to pay for it?
Well, I mean, that's the give and take of this whole process. I mean, I think, what is happening is that many incentives are being provided and offered to encourage people to sign up, but no, that nobody's going to be chased, certainly nobody's going to go to your home and say, sign up here, or else.
Yeah.
And the penalties are very gradual, so the first year it's much smaller, it goes up over time. And that's a reflection of giving people time to get used to the process, understand how it works, so that there's time to make it work.
But people who can't legitimately afford $200 a month in health coverage are gonna pay the $95 one-time fee at the end of the year instead and just not get it.
Well,
Continue to go to the emergency room and.
well, it depends. I mean, if people, there may be some options, there should be options for people, for low-income people, either through the subsidies and depending what happens with the Medicaid piece. So there could be some very good options. And again, we recognize that there are glitches and it takes some time to get together, but there are options out there, and we're just really here tonight to sort of say as much as we can about what they are, and really sort of ask you to either look, if you're comfortable yourself, to look online, and here's another place, but I know everybody's not comfortable looking online, but you've got some good local resources that will help you, and then we'll walk you through this. So don't be intimidated by all of these websites. If that's not your thing, there are other ways to approach this. Go to Service Link.
I was going to say, there's a Service Link phone number on this.
Yes.
And they will hold your hand all the way through.
They will. And it's just like with, and they do the same thing with Medicare Part D. I don't know if any of you have had any exposure to that, or Medicare's questions in general. They will help you with that. I mean, literally what they do with Part D is they give you an hour one-on-one session and walk through your medications, figure out which ones are covered by the plan you need. So that kind of detailed help is there, and it's not, and there's no charge. So that's what I would say. If you're intimidated by this, don't worry, there's a place to go that can walk you through this, and I would highly recommend that.
I wonder if some of the senior centers also are providing.
They probably are, but I'll bet you that they're funneling people to Service Link, because that's the whole, yeah, the whole point of Service Link is to kind of have a one-stop shop where you can go and ask any question. And the other advantage of going to Service Link is if you go with a question on this, I mean, it might be that you also have a Medicare question or a Social Security or some other kind of question that they could help you with. And then that way, you don't have to go to another place to get an answer to a question. So that's why I always kind of recommend Service Link, because I think it's helpful. And again, if you have Medicare, you would ask for some Medicare questions, that would be the place to go. And there's one in Manchester.
Particular, this is all 2014, I got it issued in 2013.
Definitely go to,
Ends in December 1st, and I have to have a gap between the time it drops and Medicare kicks in. I have no coverage in December. No one wants, they're $5,000 and $10,000 deductibles. This is with the approved plan with Anthem.
yeah.
They want me to pay that, and the premium is more than I was paying in Cobra, which was $800. It's $900. So, and my deductible would go up double what it is now in Cobra. It's like, there's no, I don't think there's been any control to that effect. It's been just impossible to get any reasonable coverage for 1 month, I mean, for an individual. And my age doesn't help, because you pay the highest of anyone.
There was a state high-risk pool, but that goes out of existence at the end of the year. And so I don't know if that's still in existence for that
I
last
already
month.
called
You did,
that
okay.
department, and they sent me the quotes of the same, just about the same prices. I'm like, you gotta be kidding me. I mean, I'm better off to just pay my own, medications and then hope and pray nothing happens for the month.
Just go to Walmart with the
Yeah,
$4.
well,
Yes.
I don't have a good answer for you. The only
No,
thing,
I'm
if
just
you've
saying,
gone to
this
the
is
places, go
There's a
to,
lot of us are running into.
yeah, go to, yeah. I mean, well, what we hope is starting January 1st, at least there'll be an answer. That's what we hope. So, again, there's another place to go, and I think you're probably tired of seeing websites. So, what I would just like to end with is, we don't have an answer to every question, and I think I said at the beginning, we probably wouldn't. But the goal is to give you sort of an overview, so you can sort of get a general idea of what's going to happen. And then I think it's really important, if you're somebody who's really comfortable, there's a lot of information at healthcare.gov. I've got more information. You can take some of the packets in the back. I have some Service Link brochures. And then if you're not comfortable, going on the web, which not everyone is, then definitely call Service Link or Manchester Community Health Center or somebody like that, because there is help and they can walk you through it. And I hope that everybody who has an opportunity to get some coverage at least tries to avail themselves of it, because we want you to take advantage of what's out there for you. So,
Thank you.
Kristen,
Yeah, I just wanted to point out, because I know it was mentioned in a couple of other presentations I've been to, insurance agents and brokers, there are many who will be trained, if they're not already, to help people. And if you are purchasing in the marketplace, they cannot charge you. They will get a commission from the actual insurer. Anthem is, in fact, you decide to enroll. So they are a possibility. I know you mentioned Rite Aid. And I think what Rite Aid is doing is partnering, I've seen the ads too, with trained insurance brokers who come in and spend some time at Rite Aid for any customers who might want information. So that's another possibility in addition to the navigators and the in-person assisters that you were mentioning that are hospitals and other places. But there should be more and more of them listed, all the time for your area as people come online.
Yeah, I just listed the two first ones, and
Right.
Service Link is 3. You can find others, but those are the 2 closest, and all 3 of those are in Manchester. If you're headed in the other direction to Concord, you could always plug in Concord and find out who's available in Concord too, so there's plenty of.
Do you know if the Cassian Senior Activity Centre is doing any training courses?
I don't know. If they are, my sense is that they probably would likely be aligned with the local service link since they're going to be an assister. So I'd be inclined to think that that might be the way that they would go. But they may
Some
have.
of the community groups may have people come in.
The ones that I'm aware of, the community health centers in
They're doing,
particular, are the ones that seem to be more enrolled right now. I mean, I don't know if all of them will be, but I saw at least 3 or 4 when I was looking, for that kind of information. And I would think that it would be more of them as time goes on.
The
So
senior
do we
centers
have
are more
community-
Medicaid.
Whatever you're talking about,
Health
the
centers.
finance, yeah, where are they?
There's one in Concord.
Well, there's one, there's the slide that I put up about Manchester. In fact, I can go back to that. I can find that for you. And also, I have service link brochures in the back, which I'll give you one of those too. Sorry.
Well, again, I repeat, we'll know, but there's thousands of people out there who won't know, or who will get around the system.
Well, and again, that's what we're trying to do, is we're trying to reach as many people as we can, and that's sort of our goal here, so.
And there are other groups around the state that are doing these sorts of trainings. I've seen more and more, not just AARP, and we hope that even though it seems like a small number of people here, a dozen people, that you will tell family members and friends and share information and kind of help direct them to the navigators and places they need to go. So that's really, I know when I've been at other presentations, people are often there for their children, grandchildren, friends. I heard one older man say that he was just trying to talk to his son about the importance of insurance. So he was gathering information for his son. In some cases, it's grandchildren or, other relatives, friends, neighbors. We're all kind of in this trying to help and just provide education and more places you can go and encourage people that it seems, especially if you've never had insurance, this is a very daunting situation. I mean, I work with some people who've not had insurance as friends, as a mentor, and it's tough. It's very hard to begin to think about some of the things that you need to know to purchase insurance.
These are the navigators in Manchester, so again, I'll leave it up for the rest of the meeting. So if anybody wants to write those numbers down, if you want to grab a service link brochure on the way out, those are options that are available, so.
And what many of them are doing is they're making appointments. I have seen that in
Sure.
newspaper reports, where the navigators, will make an appointment with you to come in. I noticed ServiceLink had an ad, they're hiring someone to go around the state. So they're
Well-
adding on now because they have gotten some funding to do this sort of work.
What happened was
people-
I'm sorry. What happened was there was a sum of money that got delayed, actually, by our legislature, and so we could have had it months ago, but we have it now.
Right.
They've hired, Service Link has put 12 people on, so they'll have one in every Service Link. The community health centers have got a few more, and Planned Parenthood hired some more people. Foundation for Healthy Communities, so they're really ramping up. So to your issue, they really are ramping up, really are trying to get out there and tell people what's going on. So this is the beginning of a process. We've only done, I don't know, 8 or 9 of these. We got 50 more to go, so. So any other questions? We're happy to stay for a couple of minutes if you'd rather just ask it in person, either way. So I hope this is somewhat helpful, and thank you for
Can
coming.
I take a few of these?
Yes,
So
please
thank
do.
you.
Please do. Anything that
There are
you
lots
see
of extras here.
that's not pinned down, take it with you, or we're going to leave some here at the library too, so
Great,
Good.
thank you very much, we appreciate it.
thank you.
Doug, I just heard the first promo for the ACA and AARP, so I expect there'll be calls.
Oh, yeah, well.